and welcome to Aston Health Matters, the podcast series that showcases the latest health-related research and innovations from Aston University. My name is Saira Hussain. I'm a clinician by background turned academic, and I teach healthcare science students. In today's episode, and one that I'm really excited about, we're talking about screen time, eye health, and our vision. Now, for a lot of people, and myself included, you can start the day by looking at your phone, and then you spend the rest of the day looking at a laptop screen, and then you end the day by looking at a television screen. And you can often think, is that looking at a screen a bit too much? We hear plenty of warnings online about eye strain, blue light, and lots of other topics. But it's really hard to know what evidence-based and what we just take for granted as normal day-to-day routine. Eye health isn't just about screen time. There's lots of different factors involved as well. To try and explore some of these myths, concerns, and emerging research in this area, I'm joined by my colleagues, Dr. Amy Sheppard and Professor James Wolffsohn from Aston University. Their work focuses on eye health, vision, screen use, including research contributing to the 1001 Critical Days Foundation study, looking at children's screen use and development.
My name's Dr. Amy Sheppard. I am an optometrist and an academic. So I have been researching for a number of years in the area of eye health, the anterior eye, which is the front part of the eye, and more recently, looking at the impact of screen use on the eyes.
And my name's Professor James Wolffsohn. I've been at Aston a very long time, again, an optometrist and researcher, with a particular focus on instrumentation. So how do we measure what the eye is doing, but also the instrumentation that we look at and the impact of that on the eyes.
Amy, can you just tell me a bit more about what this 1001 Critical Days study is? And what are you looking at in terms of screen use?
Absolutely. So the 1001 Critical Days Foundation is all about those super important first 1001 days of life. So it covers from pregnancy up until when children are 2 years of age. So that's obviously a really important stage that sets the scene for later life in terms of physical and mental health. So the study we have been involved in has been evaluating the evidence, so global evidence, of the impact of screen use on very young children, so up until the age of 2 years. We've heard a lot in the media and also in research, especially since the pandemic, about, screen use has really increased. It's gained more attention. And what we've noticed is that often the youngest children are not sort of included in those discussions. So this study was really focusing on those youngest children, the impacts of screen use on them, and what that might mean for their health.
Have we got any sort of early findings that you can share with us?
So we looked at evidence from around the world. We reviewed many thousands of published research articles looking at this. So as part of our interdisciplinary approach, we looked at different aspects of health. We were considering visual and ocular health, physical health, also emotional, psychological, etc. So there were some really interesting findings. So it was clear that around the world, very young children are using screens a lot. So far exceeding recommendations from organisations like the World Health Organization, for example. So even babies, so under 12 months of age, screen use was really common. And we saw that even in babies who start using screens in that first year, it tends to really increase from there. It's sort of a progressive pattern. So high levels of screen use is quite surprising. We observed from the evidence that can be associated with a range of possible impacts on children. For example, in our field, when we think about visual and ocular health, there's been quite a lot of concern that high levels of screen use might be associated with the development of myopia.
Could you explain what myopia is?
Absolutely. So myopia is when the eye doesn't see clearly. It's sometimes called short-sightedness. That's how most of us would probably refer to it. It's really increased in prevalence in recent years in many areas of the world. It's become a lot more common. What we're seeing in myopia in those short-sighted eyes is what seems to be causing it is growth of the back part of the eye. So essentially the eye becoming almost too long in that back part. So what happens is that light rays, as they travel into the eye for us to see, they focus in front of the retina that produces that blurred image, so we don't see quite so clearly. So the problem with short-sightedness isn't just needing glasses or contact lenses to see clearly, because it's typically caused by the eye essentially growing too much in that posterior, the back region. We can get almost a stretching effect of the retina, and that can cause some problems in later life for those who are affected. Those eyes are more likely to get a range of pathologies that can impact on vision. So there were a number of studies that had looked at early screen use that could be associated with myopia. The evidence is a little bit mixed there. There's some indicators that it might be. There's some indication that it might be part of the bigger picture of lots of near work, change lifestyles where we're spending less time outdoors, and that might be linked to an increased chance of myopia developing. So there's some interesting findings there. Also things like sleep disturbance, problems getting to sleep. They were more common in children with use of devices, particularly close to bedtime, or if they had devices present in their bedrooms.
So some of these studies then look at children at an older age. And again, there was very clear evidence that actually that screen time use under the age of 2 predicted problems with socializing, etc., later on in life. Now, we did identify that there's still a lot more research to be done in this area. Obviously, under 2s are not that easy to look at, particularly their eyes, their concentration, for example, isn't there. But it does show that particularly programs where they say, acceptable for all ages, well, actually, no, it's still not acceptable for those under 2s. And likewise, in terms of TV content, really, we need much more visibility for parents to indicate that actually even programs that seem to be for very young children really shouldn't be mainstream viewing for under 2s.
There's quite a lot there. So it's not just about physically using the screen, that is having some sort of physical changes to the eye, but there's also all these lifestyle factors. You said, Amy, about people not getting outside as much, and that's obviously changing things. The pandemic you mentioned obviously changed the habits for a lot of people. So I guess there's a lot there to be mindful of for children. James, what about adults? We hear a lot about screen time being, quite damaging, or you've shared some research about how it can damage our eyes in childhood. What about as we get older?
So even in your teens, we know that the amount of time you spend on screens is directly associated with the number of people who can be diagnosed with dry eye. Dry eye is always something we thought of as a disease of older age. So actually, if you're damaging your tear film and the glands that actually produce that tear film at a younger age, it's going to be really hard when you hit working age and you're having to stare at screens because of your working environment. So in the UK, dry eye now affects 1 in 3 people. So it's
Wow.
really common. And at the extreme end, they rate it compared to other diseases on the number of life years you're willing to give up to get rid of the disease. And it's equivalent to angina or being on kidney dialysis. So certainly really marked in terms of its effects. But even in milder forms, it's associated with anxiety and depression, which of course, again, are things that we know in the current age is a real problem in both children and in adults. So essentially, we're storing up problems. In terms of digital eye strain itself in adults, Population-wise, it can be up to about 95% of a population that's affected, depending on the population looked at. So very common. We know it goes with symptoms, signs, less certain in terms of particular signs that we can use to identify it. And again, we've done a big consensus report, global consensus report, looking at those treatments that have been shown to be effective. Some of them, very interestingly, blue light blocking is often thought to help in terms of digital eye strain. There are quite a few studies on it, and all of them show no effect.
That's quite shocking, because there's so much online about buy these blue light glasses, or I think my phone has a blue light filter. I can't be 100% sure, but we hear so much about that. So can you tell me some more?
And blue light might be beneficial in other things, but in terms of digital eye strain, evidence from good, solid trials show no, it doesn't benefit. Antioxidants is another thing in that category that people have done quite a few studies on, showing no real benefit. In terms of the most effective treatment that we have at the moment, that's omega-3, so essential fatty acids, essentially. So healthy diet really helps. And then there are lots of things that have some evidence. So taking regular breaks, whether that's using things like the 20-20-20 rule, or just having your computer remind you every so often to stop and take a break. Blink exercises, those sorts of things have been shown to be useful. So again, it's an area where there's developing more evidence, looking at different screen types, etc., to see where we can give true guidance in terms of what people should be doing.
What is the 20-20-20 rule?
So the 20-20-20 rule is looking every 20 minutes, at least 20 feet away for 20 seconds. So this idea really of just taking regular breaks, looking into the distance.
Thank you. That's something that my dad used to tell me to do without knowing it was a 20-20-20 rule. Normally if I was reading too much. So you've said there is evidence to show that this works. How can we actually get that sort of practically in place for people?
Yeah, these things are a challenge because, of course, it's essentially a lifestyle disease, and now we're trying to use lifestyle to change it. But we learn patterns and routines. So if it can be practiced for a while, that might be some kind of alert on your device. There are various apps and stuff that can give you alerts every 20 minutes to tell you to look away. Then hopefully that becomes sort of then natural in terms of what you do, a little bit like muscle memory. You just remember every 20 minutes actually doing this. But at the moment, that's probably the best way, is to use an app or a computer program just to give you those reminders to get you into those good habits.
I guess for anyone listening and they're now worried about, oh gosh, I spend all day on a laptop and then I go home and watch a TV, etc. Is something like having breaks, the 20-20-20 rule, is that enough, or should there be more that people are doing?
Certainly, in terms of general eye health, you should be going regularly to your optometrist. They will have a detailed look at your eyes and identify things like dry eye disease. That's helpful because you can have signs without symptoms yet, in which case that's obviously a bit more urgent that you need to act. And likewise, if you're having symptoms, identifying that it is really coming from the digital device and not something else that we should be aware of. So I think that's probably the best advice if you're concerned. And even if you're not, just those regular 2-yearly checks will really help in terms of picking up diseases that often don't have symptoms, and damage can be done before you actually notice them.
I'm quite lucky that I work at Aston. I get some of your students to check my eyes every 2 years. Amy, are younger generations experiencing sort of eye strain, or I guess impacts of eye health, differently to older generations at all?
That's a really interesting question, and possibly it might be linked to how they're actually using devices, though. So we know that screen use in younger individuals, so adolescents, young adults, they're having really long durations of screen use, typically on handheld devices, close up for many hours a day. We also know that young people are more likely to be multitasking with their devices, so using more than one at a time. And again, that's associated with an increased chance of experiencing discomfort. So the symptoms of digital eye strain that James mentioned earlier. So that can be discomfort in the eyes, headaches, watery eyes. Some authors also include some of the musculoskeletal symptoms as well as part of that spectrum of digital eye strain, so having a sore neck and those sorts of things. And as James said, we know that dry eye in particular, which was considered when I was training, we were always taught that dry eye was something that older adults got, but that's been seen more and more in the younger population. Older adults have often got other things going on as well. So the majority of individuals over time will become presbyopic. That's when we lose our ability to focus clearly on near objects. It's why people start having to hold things further away to see them clearly once they're in their 40s. That can pose a particular problem with using digital devices, making sure that you're focusing as clearly as you can be. So that's one problem. Older adults are also more likely to have a range of problems like cataracts. That's really common with older age. Some interesting findings from work that we've done at Aston. We looked at the impact of screen use and duration of screen use, particularly in adults aged over 60 years. And we were finding the patterns of use were different. So older adults more likely to be using, say, a tablet rather than a smartphone, for example. Some of the durations of use were still quite long, though. Some were experiencing several hours per day, but many of them were experiencing discomfort with their eyes associated with screen use. So it isn't something that we just think of as affecting younger people. There's symptoms, potential problems, across the range of ages.
That's really interesting. I know my grandma has recently got a phone and she can now watch YouTube videos. So there's a lot more phone use there than there ever was. You mentioned that your eyesight can change from 40 onwards. So as someone that's in their mid-30s, what's something that I could do now to sort of, protect my eyes and look after them moving forward?
Yes, so presbyopia, that's that's the name for the condition where we lose our ability to focus on near objects. There's probably not much you can do about that developing. It's something which begins actually in childhood as the lens inside the eye changes and grows throughout life. It becomes less good at changing shape and increasing in power so we can focus on those near objects. So what we see, there's been various studies which will show a decline in how well we can focus from childhood onwards. So you're already well down that slippery, slidey slope. There's probably not much you can do there. It tends to be once people are in their 40s and they haven't got much of that focusing power left, that just tips them over the edge with what they can cope with versus what they can't. I think James has made the point already that probably the most important thing that you can do, any adults can do, to make sure they're getting their eyes checked regularly by an optometrist. So not just if you're experiencing symptoms, but those routine eye checks are really important in picking up problems that may be developing, or even conditions which might not be associated with any symptoms in the early stages.
Can you tell me a bit more about the other sort of research and trials that are going on at Aston that you're aware of, James?
Wow. Huge number of different trials. So we work a lot in that myopia space, so with young children. Over the last 15 years, it's been transformative because we now have treatments, things that can actually slow down the progression of myopia. The best thing is to actually go outdoors more and get good sunlight. That's very effective at actually meaning you're less likely to go short-sighted in the first place. But if you are short-sighted, there are now spectacle lenses, contact lenses, atropine, which is a pharmaceutical, has just come into the UK in terms of its use. And Aston has been leading on many of those trials, seeing how effective they are and what's the best way in terms of managing these children. And we're particularly looking at early biomarkers because now we have multiple treatments, actually which treatment is going to work best for your child. And also we know that the stretching of the eye, which is what happens in myopia, is fastest when they're youngest. So we really need that maximum intervention right at the start. So those are some of the trials we do. We do a lot of trials, again, in the sort of dry eye and digital eye strain space, again, looking at new treatments and particularly trying to understand how they work. So what's the mechanism of action? Because then we can better target individuals in terms of the treatments that we are suggesting. There are many other areas of research as well. For example, in the teaching space, we've been looking at artificial intelligence and how this could help train students. With students, one of the most important things is communication skills. And so with an AI avatar, they can now chat to this person and we can tell them what kind of attributes that they have, whether they're nervous or aggressive. And so the students can practice having that conversation. And then afterwards, a transcript is produced so we can see exactly what they said and what the avatar said. And it can actually also mark them against a rubric. So it can check that they've introduced themselves to the patient and they showed empathy, for example. And so this is really powerful for them being able to practice different scenarios to really refine their technique before they ever see a patient. And so these sorts of things, we have some very expensive simulators, which again allow them to examine an artificial reality, if you like, eye. So we can give them a much broader range of pathology that they will see again before they ever see patients. So that's another area of research that we're active in.
You're very busy, is what I am hearing from that. I think it's so important to hear about all the different activities that are going on. And this idea of AI, which is such a hot topic, is so important. And it's great to see that embedded in teaching. I guess, Amy, how is AI beginning to change eye care research as well? So not just from a teaching perspective, from, I guess, care research, next steps.
I think that's been going on for a number of years, actually, before AI really came to the forefront of sort of public awareness. In ophthalmology, optometry, one of the things that we do as part of our examinations, both go for an eye test or if you get sent to the hospital to an ophthalmologist, they'll often take detailed images looking at the back parts of the eye, the retina. Those images have been widely used in research involving artificial intelligence. So looking at whether we can predict eye disease at an earlier stage, who might be at particular risk of certain eye disorders like diabetic retinopathy, age-related macular degeneration, developing what particular treatments might suit them best. So those are all areas that AI has been active in the field. Also, it's often said that the eye is the window to the soul, isn't it?
Yes.
Got lots of small blood vessels within the eye that can be imaged with these high-tech pieces of kit. And also AI is being increasingly explored as an approach to looking at pictures of the retina. What can we deduce about an individual's cardiovascular health? Could they be at risk of other disorders potentially in later life, things like Alzheimer's disease? So really, in our field, there's been a lot of work already in AI.
Sounds really positive, and especially this concept of, I guess, that cross-specialism work as well. The eyes aren't just can you see, can you not see. It's such a indicator if there's other things going on or if other conditions could be affecting the eye. So I think that's really great to hear about how, I guess, positive and how AI could be sort of embraced in optometry. So you both mentioned about, doing all this research that goes globally across the world, and you're seeing all these differences. I guess what I want to know is, are there differences in different cultures, different parts of the world, or are eye habits fairly similar?
There certainly are big differences, and quite often we see it with changes in populations. So, for example, in Asia, particularly in East Asia, the levels of myopia, short-sightedness are incredibly high. Your
Mm.
chances of having myopia if you're a student is in the order of about 95%. Um, and that's something to do with their lifestyle, because it's a very intense educational environment, but also something to do with genetics as well. Likewise, we can look back to populations from the past before education was introduced. Myopia didn't really exist. As education was introduced, genetics are the same, but myopia increased quite dramatically. So again, we can actually use these population differences around the world to understand some of the causes of the problem. And that will continue to change. And many of the things we're tackling now in terms of eye care are lifestyle related. We've talked about dry eye, we've talked about short-sightedness, both to do with lifestyle, and potentially then lifestyle changes may be part of the solution as well.
That's really interesting to kind of hear how, I guess, lifestyle changes have made such huge impacts. Looking ahead, what do you think is going to be the biggest eye health or several challenges over the next 10 years?
Ah, interesting. Yes. So it is about that integration of artificial intelligence. So it's about that balance of making sure that we use the technology to really be able to examine images in a lot more detail than a human can do. Very good at guiding people, and particularly when you're new in a profession, it will give you that level of guidance to help you to make sort of top level decisions. But there's a danger with that side that then you become reliant on it. And therefore, you never actually learn those nuances of how to diagnose things correctly, how to manage things correctly. So I think that that's going to be a challenge for the future. There's a lot of interest in neurodegenerative diseases. And again, through the back of the eye, we can see the only part of the brain that you can see without cutting into the skull. What can we learn there, and how can that help us not only predict the future, but hopefully then circumvent that future, or at least make things better in that space. So those are just some of the challenges, I think, for the future. But in some ways, those are also great opportunities.
I was going to say the exact same thing. It sounds like it's sort of a model for the future in terms of how we can try and improve not just research what we do. And I think at Aston, it's so great that the research conducted doesn't just sit on a computer file. It actually has real life impacts, and I think that's what the 1001 critical foundation study is doing, as well as other research that you mentioned. Amy, you've given us some tips already about, looking after eye health or trying to introduce some habits. Are there any others that you could share with us?
I think for most of us, using screens is part of our lives, isn't it? Often at work, we'll be using a screen for multiple hours per day. So I think it's quite important to ensure that you're using it in as safe, as comfortable a way as possible. If you need a refractive correction, so to see clearly, even if it's only small refractive correction, research has showed that it can be beneficial in improving comfort when you're using screens. So make sure you're wearing your specs if you need them. Making sure that you've got your workstation set up properly, that you're in, a suitable office chair, and you've got your computer and monitor set up where they're meant to be. Avoid any glare on the computer screen as well. Again, that can be associated with discomfort. So there's a few things to do with the setup for use, particularly of computers, for long periods of time. And again, just making sure that you're incorporating those breaks as a regular part of the working day.
And getting outside as well. So having some walks outside. So that brings us to the end of today's episode. Thank you so much, Amy and James, for your time today. We've discussed everything from screen time to different populations to eye health and so much more. So it's a topic that affects many of us. I hope this has been really useful for anyone listening. And thank you, and I'll see you next time.